My name is Dr. Sesen Negash. I'm in the Counseling and School Psych Department, and I direct the Marriage and Family Therapy program. Essentially, we train marriage and family therapists in a 2-year program to work with couples, families, and individuals in the community. And I'm also a therapist, and so I have a small private practice that I do when I'm not, educating marriage and family therapist trainees. I've always been really interested in how relationships work. That could have served me in a lot of different fields, but I really have been really connected to working with mental health since early experiences working outside of Child Protective Services, and saw the need for really integrating families in the care of children, and thought what better field to do that work in than in marriage and family therapy, where we really think systemically and relationally about how problems are created, maintained, and solved for. Well, I'm always thinking about the work I do in terms of how it helps the communities that I really care for. The Black community, the immigrant community here in San Diego, we do have a community, and it's important that we're serving that community to the best of our abilities. And that's really understanding some of the socio-political, economic context and how they impact them in their wellness. And so part of my role is to really promote students into the field and really supporting them through the field so that they can go out and do the work that is so essential and represent the Black community in ways that we really need. And one of the things I realized early on in this field is that it's a predominantly white field led by predominantly white Eurocentric ideas and practices. And so as a professional, as an educator, it's helpful and it's important for me to make sure that students are really thinking not just within the lines that they're told exist, but also thinking about how they can be innovative, creative, and thoughtful about how to use their connection to the community to serve the community. So I really enjoy the work that I do. Our program is really exciting and something I'm really proud of because we have a lot of students of color in our program, and it's important that we just don't bring students of color into our program, but we know how to give them a sense of, help them feel included and like they belong in our program. I think as far as we've come with really taking mental health and making it something we can all have a conversation around, something that is not stigmatized and considered to be taboo, we have a long way to go. And often I see within the Black community in particular that there's still a lot of distrust around talking about areas where we may be experiencing challenge or hardship, and really being vulnerable with communities that have for many centuries harmed us. And so I think creating a space where folks can really feel like they can be vulnerable and feel safe is really important, but we're not there yet. I think there's still a lot of clinicians out there, admittingly, who do harm instead of help sometimes. And so I think really trying to build not just interest in folks addressing their wellness, but creating spaces where they can do so in a way that they can actually benefit is really important. So the stigma is still there, and the challenges around serving the community in a way that really meets their needs is still there. Really, I think, our representation matters. I think in order to build the trust in the mental wellness community, we have to be the face of it in some ways. And, with the numbers that we see now, around 4%, we can't do that. And I want to say, it begins with them. It begins with this generation. We sometimes think as clinicians as these older white men who can only do the job. And really, we want Gen Zers, we want millennials to start thinking about how they could be, the generation to really open the door for the Black community to really find safety in mental wellness support.